Yeah, to start with, menstrual migraine is occurring in 2/3 of women will have menstrual migraine, and that means that they will have at least migraine attacks in 2 out of 3 menstrual cycles. We made a distinction between pure menstrual migraine, where you only have these migraine attacks during the menstrual period but not outside this period, and that's really very rare. So most of these women, they have both non-perimenstrual and perimenstrual attacks. In roughly, you could say that 2/3 of women will have menstrual-related attacks. It's really hard for people to remember, so we also notice that when you ask patients, it's better to have a prospective e-diary to really prove that whether there's menstrual migraine. And we also know that these perimenstrual attacks are of a longer duration than the non-perimenstrual attacks. Both attacks are of longer duration compared to men. And these perimenstrual attacks, they are of longer duration, but they're also more severe, and they're more associated with side symptoms like nausea, vomiting, etc. And they're less likely to have a sustained response on the acute treatment. So you see that the triptans are less effective. They work, but the next day people have to, these women have to take new medication. And with that, you have a long period during these perimenstrual attacks where you are in need of acute medication. I think the management in real world practice is lacking behind because there is not much knowledge about this. So, for instance, in Holland, we noticed that the GPs that see migraine patients, they provide them with triptans, but in a too low dosage, because we also know that women are more likely to report side effects due to the medication, because you have a lower body weight compared to men, so it's more likely that you have some more side effects. With that, GPs, they provide them with a lower dose of the triptans, and they don't ask these women whether they have recurrences. So with that, the treatment is a failure actually, and women don't go back to these GPs to ask for new medication, and that's one of the things that we should encourage our patients to do.